This topic, let's talk about primary care physician and the role of a primary care physician. So back in the day, we used to call our primary care physician a family doctor. That included internal medicine doctor, a physician who was trained in family medicine, can be a pediatric physician, but this is your first go-to contact in terms of healthcare. Primary care physicians play a major role in doing the preventive care screening, diagnosing the initial problems, health conditions that you have, coordinating care between different specialists, trying to see who's the best specialist that you need to go to. What other critical roles do primary care physicians play? The whole concept now of healthcare and how well you do with your outcomes is based on how much information you're given and how well you are notified on your health conditions and the plan of care. The role of a primary care physician is to improve health literacy. That is our primary goal these days, so that we can improve your health outcomes. And what is health literacy? The ability to understand, not in big language words, but in simple terms of what does your health condition mean, what impact will it have on your health and long-term outcome, and your quality of life as well. Because we only sometimes look at the quantity of life, but it is also the quality of life that's very important. So when you're looking at a primary care physician, please make sure that you also discuss and that your primary care discusses with you all these factors that improve your trust in your primary care provider, that make sure that you are having the best of care. The other things that primary care doctors really talk about is preventive care medicine. And there are different kinds of preventive care medicine. Let me talk a little bit about the different kinds of prevention. First is primary care prevention. Primary prevention is when you don't have the disease yet, you have risk factors, but how do we prevent you from even getting it? Like say, for instance, yes, you have family history of diabetes or hypertension, but how can we ensure that you don't get it? And that's the plan where primary care providers come into play to say, hey, let's make these lifestyle changes. Let's stop these habits that can cause or worsen or progress these conditions. And that's primary prevention. Secondary prevention is when you already have, say, high blood pressure, pre-diabetes. That is where your primary care doctor will say, let's do labs. Let's do your annual screenings. And then let's look at where we are. And now that you have it, you have the problem, let's see how we can make sure that we stabilize it. And the third thing is tertiary prevention. When, say, in an instance of cancers, we already have a problem at hand, we're treating it, how do we prevent it from getting worse? So your primary care physician plays a major role in all of these three arenas, and it becomes very critical for you to have routine follow-up with your primary care doctor, who can then coordinate the care between all different specialties when needed and get the right testing at the right time. That includes your annual routine screening and also your regular follow-ups. There are patients sometimes who do talk to me about what is an annual screening and or annual visit. What is the difference between that and my regular visit? A regular visit is where you bring in your acute problems. We talk about what's going on now. Plus, we look at what problems you already have and are we on path with our plan of care and making sure that you're taking care of yourself. Whereas an annual screening, which is now becomes more mandatory from all insurances as well, is where we look at the overall picture. We look at all your disease, all the issues that we've had, and we make sure that you're on path. We make sure to do primary prevention so that you don't end up with those issues, and that's where we do preventive care screening tests. Did we get your mammograms, colonoscopies? Are we on target with your vaccines? All of these things is what a primary care physician is there for. And please make sure that you utilize your primary care doctor and make sure that we have very good health outcomes.